Did you know your feet show early signs of diabetes? Diabetes affects circulation, nerves, and skin health, often leading to noticeable foot-related symptoms before a formal diagnosis. Ignoring these warning signs can result in serious complications, including infections and even amputations. Why foot health matters for diabetics? Diabetes primarily impacts blood circulation and nerve function. Poor circulation slows healing, increasing the risk of infections, while diabetic neuropathy reduces sensation, making injuries harder to detect. Small issues like dry skin, tingling, or swelling can escalate into ulcers or gangrene if left untreated. The dangers of ignoring foot problems. Diabetic neuropathy affects nearly 50% of diabetics, leading to numbness, unnoticed injuries, and slow healing wounds. About 15% of diabetics develop foot ulcers, with 1 in 5 cases leading to amputation. Untreated infections may even cause life-threatening sepsis. How to prevent complications. Regular foot inspections, proper footwear, and early intervention can help prevent severe foot problems. Stay tuned as we reveal 12 warning signs your feet might be showing about diabetes, along with expert foot care tips to keep your feet healthy. Sign number 1: numbness or tingling in feet. One of the earliest signs of diabetes is numbness or tingling in the feet, caused by diabetic neuropathy. High blood sugar damages the small blood vessels that supply oxygen and nutrients to nerves, leading to nerve deterioration. This results in impaired sensation, making it harder to feel pain, temperature changes, or injuries. Diabetic neuropathy typically starts in the feet and toes since they are farthest from the heart and require good circulation. Damaged nerves send abnormal signals, causing tingling, burning, or sharp pains, especially at night. In severe cases, nerves stop transmitting signals altogether, leading to complete numbness. Why numbness or tingling is an early warning sign. Many people with prediabetes or early-stage diabetes notice tingling in their feet before receiving a formal diagnosis. Since nerve damage starts before blood sugar reaches critical levels, this symptom is often overlooked, delaying early intervention. If untreated, diabetic neuropathy can cause loss of balance, foot ulcers, infections, and even amputations. Recognizing numbness or tingling as a warning sign can help prevent severe complications. Pay attention to your feet, early detection can save your health. Sign number 2: burning or sharp pain in feet. A burning or sharp pain in the feet, especially at night, is a common symptom of diabetic neuropathy. High blood sugar damages the nerves responsible for sensation, leading to false pain signals or failure to detect real injuries. This results in burning, stabbing, or electric shock-like sensations, even when there is no external cause. Since the body is less active at night, this pain often becomes more noticeable, making it difficult to sleep. Why nighttime pain should not be ignored. Burning pain is a sign of worsening nerve damage and can progress to constant pain or numbness, increasing the risk of unnoticed injuries, ulcers, and infections. Left untreated, diabetic neuropathy can cause balance issues, walking difficulties, and even amputations. Early intervention is key. Managing blood sugar, staying active, and using nerve-supporting treatments can help slow progression and reduce pain. If you experience persistent foot pain, seek medical attention to prevent severe complications. Recognizing this symptom early can help protect your feet and overall health. Sign number 3: cold feet despite warm weather. If your feet feel cold even in warm weather, it could indicate poor circulation due to diabetes. High blood sugar damages blood vessels and nerves, restricting oxygen-rich blood flow to the extremities. This condition, known as peripheral artery disease, PAD, leads to cold, numb, or tingling feet, often appearing pale or bluish in color. Over time, diabetes causes blood vessels to narrow and stiffen, further reducing circulation and preventing warmth from reaching the feet. Diabetes versus other causes of poor circulation. While cold feet can result from other conditions, key differences include diabetes and PAD, chronic cold feet, numbness, slow healing wounds, and infection risk. Hypothyroidism, cold intolerance, fatigue, weight gain, and dry skin. Raynaud's disease, temporary color changes in fingers and toes due to blood vessel constriction. anemia, low iron, cold extremities, dizziness, and pale skin. If cold feet come with numbness, tingling, or slow healing, diabetes may be the cause. Managing blood sugar, staying active, and proper foot care can help improve circulation and prevent complications. Take action early to protect your foot health. Sign number 4: slow healing wounds or ulcers. If you notice that cuts, blisters, or wounds on your feet are taking longer than usual to heal, it could be a sign of diabetes-related complications. High blood sugar levels damage blood vessels, reducing blood flow to the feet and limiting the supply of oxygen and nutrients needed for tissue repair. This impairs the body's ability to fight infections and heal wounds efficiently. Diabetes also weakens the immune system, making it harder for the body to fight bacteria that enter through even the smallest cuts or blisters. Over time, these minor injuries can develop into serious foot ulcers if left untreated. The danger of foot ulcers and risk of infection. Foot ulcers are open sores or wounds that don't heal properly, and they are one of the most dangerous complications of diabetes. Studies show that about 15% of people with diabetes develop foot ulcers, and a significant percentage of these cases lead to serious infections, gangrene, and even amputations. Common signs of diabetic foot ulcers include redness, swelling, or warmth around a wound, drainage, pus, or a foul smell, skin discoloration or blackened tissue, pain or numbness around the wound. If an ulcer becomes infected, the infection can spread to the bone or bloodstream, posing a life-threatening risk. This is why regular foot inspections, proper wound care, and seeking medical attention for slow-healing sores are critical for people with diabetes. Sign number 5: dry, cracked skin on feet. If you're experiencing dry, cracked skin on your feet, it could be a warning sign of diabetes-related nerve damage, diabetic neuropathy. High blood sugar can affect the autonomic nervous system, which controls sweat and oil production. When the nerves responsible for moisturizing the skin become damaged, the feet can become excessively dry, flaky, and prone to cracking. Healthy skin relies on natural oils and moisture to stay supple and protect against external irritants. However, diabetes disrupts this balance, leading to dehydrated skin, peeling, and deep cracks, especially around the heels. If left untreated, dry skin can worsen, creating an entry point for harmful bacteria and infections. Increased risk of infections due to skin cracks. Cracked skin isn't just a cosmetic issue, it can pose serious health risks for diabetics. Open cracks allow bacteria and fungi to enter, increasing the risk of foot infections, ulcers, and even cellulitis. Because diabetes weakens the immune system and slows healing, even small infections can escalate into serious complications, potentially leading to gangrene or amputations. To prevent infections, people with diabetes should keep feet moistured with diabetic-safe lotions. Avoid walking barefoot to prevent injuries. Inspect feet daily for cracks, cuts, or signs of infection. Wear breathable socks and properly fitting shoes. Sign number 6: skin discoloration, dark patches or redness. If you notice dark patches, redness, or unusual skin discoloration on your feet, it could be a sign of poor circulation due to diabetes. Peripheral artery disease, PAD, a common complication of diabetes, occurs when high blood sugar damages blood vessels, reducing blood flow to the feet. This leads to skin darkening, hyperpigmentation, redness, and a bluish tint due to oxygen deprivation. PAD can also cause pain, swelling, and slow healing wounds, increasing the risk of serious complications. Early signs of infection or inflammation. Red, warm, or swollen skin can also indicate an infection or underlying inflammation. Diabetes weakens the immune system, making it harder to fight infections. Even small injuries can lead to cellulitis, abscesses, or ulcers, which, if untreated, may require antibiotics or surgery. Preventive tips include: monitor foot color changes regularly. Improve circulation through exercise and proper diabetes management. Seek medical attention for persistent redness or wounds. Sign number 7: frequent foot infections. If you experience frequent foot infections, it could be a sign of diabetes-related immune system weakness and poor circulation. High blood sugar levels create an ideal environment for bacteria and fungi to thrive, making diabetics more prone to infections. Additionally, nerve damage, diabetic neuropathy, reduces sensation in the feet, making injuries or cuts go unnoticed, allowing infections to develop unchecked. Common foot infections in diabetics are athlete's foot, a fungal infection causing itching, peeling, and cracked skin, increasing the risk of bacterial infections. Toenail fungus, thick, discolored, brittle nails that can become painful and difficult to treat. Cellulitis, a bacterial skin infection leading to redness, swelling, warmth, and pain, which can spread quickly if untreated. Preventive tips include: keep feet clean and dry to prevent fungal growth. Trim toenails carefully to avoid injury. Wear breathable shoes and moisture-wicking socks. Seek medical attention for persistent infections. Sign number 8, swelling in feet and ankles. If you experience swollen feet and ankles, it could be a sign of poor circulation and kidney complications due to diabetes. High blood sugar damages blood vessels and nerves, leading to fluid buildup, edema, in the lower extremities. Diabetes also weakens the blood vessels, making it harder for the body to circulate fluids properly, resulting in puffy, tight, or heavy-feeling feet and ankles. Warning signs are diabetic nephropathy, kidney disease. Swelling in the feet may also indicate diabetic nephropathy, a condition where high blood sugar damages the kidneys, making it difficult to remove excess fluids from the body. Signs of kidney-related swelling include swelling in both feet and ankles. Puffiness around the eyes. Unexplained weight gain due to fluid retention. Preventive tips are: control blood sugar levels to reduce kidney strain. Elevate feet to improve circulation. Reduce salt intake to minimize fluid buildup. Consult a doctor if swelling persists. Sign number 9, ingrown toenails and increased nail problems. If you frequently experience ingrown toenails, brittle nails, or fungal infections, diabetes could be the underlying cause. High blood sugar weakens the immune system, making it harder for the body to fight off bacteria and fungi. This increases the risk of nail infections, discoloration, thickened nails, and painful ingrown toenails. Poor circulation and nerve damage caused by diabetes also make it easier for minor nail issues to turn into serious infections. Ingrown toenails, where the nail grows into the surrounding skin, can lead to pain, swelling, and bacterial infections that may spread if left untreated. Why regular foot care is essential? Diabetic foot problems can escalate quickly, so proper nail care is crucial. To prevent complications, trim nails straight across to avoid ingrown toenails. Keep feet clean and dry to reduce infection risk. Check nails regularly for signs of fungus, discoloration, or thickening. Avoid cutting nails too short or picking at cuticles. If you notice persistent nail infections or slow healing wounds, consult a doctor. Early intervention can prevent severe complications like foot ulcers or even amputations. Prioritize foot care to protect your health. Sign number 10, loss of hair on toes and feet. If you notice hair loss on your toes or feet, it could be a sign of poor circulation caused by diabetes. High blood sugar damages blood vessels, reducing their ability to deliver oxygen and nutrients to the extremities. This condition, known as peripheral artery disease, PAD, restricts blood flow, leading to weakened hair follicles and eventual hair loss on the toes and feet. Since hair growth depends on a healthy blood supply, its disappearance indicates that your feet are not receiving adequate circulation. This is an early warning sign that diabetes may be affecting your vascular system, increasing the risk of slow-healing wounds, infections, and nerve damage, neuropathy. What hair loss on feet means for circulatory health. Losing hair on the feet suggests underlying circulatory issues that could lead to serious complications if left untreated. Other signs of poor circulation include cold feet, numbness, discoloration, and slow-healing cuts. To improve blood flow, manage blood sugar levels to prevent further vascular damage. Exercise regularly to promote circulation. Avoid smoking and unhealthy fats, which contribute to clogged arteries. If you notice hair loss on your feet, consult a doctor to assess your circulation and prevent complications. Sign number 11. Claw toes or hammer toes. If your toes start curling downward or becoming rigid, you may be experiencing claw toes or hammer toes, which can be a sign of diabetic neuropathy. High blood sugar damages the nerves that control muscle movement, weakening the small muscles in the feet. As a result, the tendons tighten, causing the toes to curl or become deformed over time. Diabetes also reduces blood flow and sensation, making it difficult to notice these gradual changes. Without treatment, claw toes and hammer toes can lead to pain, corns, calluses, difficulty walking, and even open sores due to friction against shoes. How it can lead to foot deformities over time. If left untreated, claw toes and hammer toes can become permanent deformities, increasing the risk of ulcers, infections, and mobility issues. Early intervention is crucial to prevent worsening conditions. To protect foot health, wear proper footwear with a wide toe box to reduce pressure. Do foot exercises to strengthen muscles and improve flexibility. Manage blood sugar levels to prevent further nerve damage. Noticing toe deformities? Seek medical advice early to prevent long-term complications. Sign number 12. Changes in foot shape and arch collapse. If you notice your foot shape changing, flattening, or the arch collapsing, it could be a sign of Charcot foot, a severe complication of diabetes. Diabetic neuropathy, nerve damage, weakens foot muscles and reduces sensation, making it difficult to feel small fractures or injuries. Without pain as a warning sign, people with diabetes may continue walking on an injured foot, leading to bone weakening, fractures, and deformities. As the condition progresses, the arch may collapse, causing the foot to take on a rocker bottom shape. The bones may also shift, leading to joint dislocations and swelling. Why early diagnosis is crucial? Charcot foot is a medical emergency because untreated fractures and deformities can lead to severe disability, chronic ulcers, infections, and even amputation. If you notice redness, swelling, warmth, or a sudden change in foot shape, seek medical attention immediately. To prevent complications, avoid excessive pressure on the feet by wearing supportive shoes. Check feet daily for swelling, redness, or shape changes. Manage blood sugar levels to protect bone and nerve health. Early intervention is key. Don't ignore foot shape changes. Prevention and foot care tips for diabetics. Check your feet daily for cuts, blisters, redness, swelling, or infections. Use a mirror if needed to examine hard-to-see areas. Wear comfortable, well-fitting shoes with a wide toe box to prevent pressure and friction. Avoid tight or high-heeled shoes. Keep feet moistured to prevent dry, cracked skin, but avoid applying lotion between toes to prevent fungal infections. When to see a podiatrist? Visit a podiatrist regularly for professional foot exams, especially if you notice wounds, numbness, or deformities. Early care prevents serious complications. If you found this helpful, like, share, and subscribe for more health tips. Have you noticed any of these symptoms? Comment below and share your experience.